What's up, you guys? Coach Cody here. So today I have a little bit of a presentation for you. I'm going to teach you how to do testosterone because personally I believe in harm reduction. So, there's a lot of people out there that just don't have enough education on compounds and hormones, and they don't even really need to be doing it, but they're doing it anyway. So personally, I think you should get a blood test done. You should figure out if you have low testosterone. You should keep track of the issues you're having. You should write down your symptoms, and you should be prepared. Because in one of my previous videos, I talked about how it's so common for guys, especially in Canada, to go see a doctor because they believe they have low testosterone, which they do. And instead of getting a blood test, instead of getting a proper consultation, they're kind of given a psychological evaluation. And it seems to be much more common to leave with a prescription for antidepressants, which I believe makes matters worse in every kind of way. And I also believe that antidepressants are too widely prescribed, as if it's a one-size-fits-all solution, whereas testosterone is a one-size-fits-all solution. Okay, so I like to draw mine out with an 18 gauge syringe tip right here. I'm about to do 1 mil, so I have it to the number 1. This is 250 milligrams. I do this twice a week right now. So I got the cap back on. I got 1 mil in the syringe, but I'm not going to put this 18 gauge into myself. That's going to hurt way too much. So I'm going to switch this off for a 25 gauge half-inch tip. So the tip is half-inch, 25 gauges wide. So I'm going to try not to touch any of it. My hands are clean. Everything's alcohol swabbed. So I'm going to take off this piece right here. And I'm going to put on, boom, there we go. Very important to switch the tips. You can keep this and use it again, right? But if you have a bunch, throw it out. It's better to use a new thing every time. Okay, so now, notice how much smaller that is? That's what's going to go in the skin. So what I like to do is I like to go about right here. So I put my hand at the side of my waist, and then I just basically turn my hand as far as it'll go. So I'm right on the hip, basically, with my middle finger as far back as I can go, about right here. That's where I'm going to want my shot. It's not going to be perfect, but that's where it's going to be. And you're kind of relaxing your foot, relaxing the leg. Now I'm in. It's in. Now I can just move my hand back and push in slowly. There's no rush. I'm just relaxing. I'm leaned up against the window. It's almost done. Sometimes it's a little bit slow, but I actually hit a really good spot this time. There we go. Done. Got my alcohol swab here. And I'm going to put some pressure on it and kind of massage it in. Massage it in there. Boom, done. That's all there is to it.